thank you for being here and taking your time this morning. Well, first of all, I'll ask Denisha if she would call the roll of the board members, please.
Yes, Chairman. Norman Boyd,
Here.
Tommy Hopkins,
Here.
Cynthia Rucker. Cynthia Rucker. Roger Folsom,
Here.
David Cruz,
Here.
Anthony Williamson. Anthony Williamson. Nelva Lee,
Here. Cynthia Rucker's here also.
thank you.
Thank you.
Shane Mobley. Shane Mobley. Robert Coles.
Here.
Chairman, that concludes my roll call.
Thank you, Denisha. And see, we have a quorum to conduct business. And we have a rather full agenda today, and we'll move right through that. We have, as a board, we're going to be asked to consider initial adoption on 6 different items and a few other items that we'll cover in the agenda. But first on the agenda, I'd like to ask our secretary, Dr. Cynthia Rucker, if she had a chance to review the minutes of the February 8th meeting and can in fact recommend their approval.
Good morning. I did review the minutes and I did find them in order and do recommend them be approved.
They've been recommended for approval. Is there a second?
Second.
Motion has been seconded. All in favor, say aye.
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 Aye. Opposed? Abstaining? Hearing none, the minutes are approved. Thank you very much, Dr. Rucker. Next on the agenda, I have some comments here as we open, and another item that we'll be asked to vote on. And the first is, last meeting we talked about some need to revise the bylaws of the board since they hadn't been done for some time. And they have been updated, and I'm going to ask our general counsel, Melanie Simon, if she'd make some comments on the changes that have been made prior to our taking a vote.
Thank you, Mr. Chairman, Commissioner Carlson, and members of the board. Section 7 of Article 5 of the bylaws has been revised to read as follows. Virtual meetings. In accordance with OCGA sections 50.15a and 50.14.1f, the board shall be authorized to conduct meetings virtually via telephone, video, web conferencing, or other means of remote communications, provided that any such meeting is otherwise conducted in a manner consistent with these bylaws. The previous language in this section 7 referenced the board's authority to conduct conference telephone calls in emergency situations only. The revised language is now consistent with state law under the Georgia Administrative Procedure Act, which gives state agency boards general authority to conduct virtual meetings. This revised language also contemplates newer technology for conducting meetings and does not limit the board to conference calls. Article 6 of the bylaws authorizes the board to amend the bylaws by vote, provided they have submitted in writing to the board at the previous meeting a copy of the proposed revisions. These revised bylaws were presented at the February meeting, and so if the board so chooses, it is within its authority to adopt the amended bylaws at the meeting today. And I'm happy to answer any questions.
Any questions, comments from the board, please? Hearing none, is there a motion to approve the revised bylaws?
Roger Folsom, motion for approval, Mr. Chairman.
David Cruz has made the motion for approval, or is there a second?
Roger Folsom, second, Mr.
Roger
Chairman.
Folsom is seconded. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, they are approved. Melanie, thank you very much for your comments. Next, under my comments here, we're being asked as a board, we are required to approve the executive director of the dentistry and pharmacy board. And there's a resume in your board packet that went out for James Joyner, who has been approved by those boards as their executive director. Mr. Joyner is currently the attorney for that board. And so I would respectfully ask that we make a motion for approval. Is there a motion for approval?
Roger Folsom, motion for approval.
Roger
Mr.
Folsom has moved to approve. Is there a second?
Tommy Hopkins, second.
Dr. Hopkins has seconded. All in favor say aye.
Aye.
Opposed? Abstaining? Hearing none, it is approved. Thank you very much. The last item under my comments relates to a former board member, Dr. Russell Crutchfield, who recently left the board since he was appointed the COO for the governor's office. Quite a nice promotion for Russell, and I'm sure well qualified to do so. But for recognition of his service on this board, we prepared a desk plaque to recognize Russell's service, and I will be, Denisha will be getting that over to the governor's office for Russell. But with sincere appreciation for the years of dedicated service to the Board of Community Health, those being the years from 2016 to 2024, is presented to Dr. Russell Crutchfield from the board and from Commissioner Carlson. So Denisha, if you take possession of that and see that Russell gets it, I'd appreciate it. Thank you. Next item on the agenda is the report from David Cruz on the audit committee meeting that was held earlier this morning. David is the chairman of the audit committee. So David, would you please give us your report?
Yes, Mr. Chairman, this morning, the audit committee met and heard a very detailed report from Sonia Allen Smith, who is the Inspector General, concerning audits. One of the first things she did was she did introduce 3 new team members that she has recently filled some vacant positions for the audit team. So they have a full audit team now, internal, to work with the various audits that take place both on the state and federal level. But Sonia gave us reports there on the current programmatic audits that are taking place at the state level. There are 3 of those. And then, of course, the annual statewide single audit is being completed for the year ended June 30th. And that report will be coming forth soon. But then she also reviewed some prior audits, programmatic audits. There are 4 from CMS and 2 from the State Department of Audits and Accounts that are being completed. She gave updates on those. And then she spent a great deal of time going through the last financial audit for the year ended June 30th, 22, where we've had some prior year findings that were outstanding. There were 11 of those findings. 5 have been completely resolved and 6 are partially resolved. And then of those partially resolved, they're all scheduled to be resolved in the current year. She reported there were no material findings outstanding. And as I said, she gave a pretty detailed report on each of those findings. So there were no outstanding questions for the committee. So that's my report, Mr. Chairman.
Thank you, David. Are there any questions, comments from the board for David, please? Hearing none, thank you, David, for that report. Next on the agenda, I'll turn it over to Commissioner Carlson.
All right, thank you, Mr. Chairman, members of the committee, and those of you joining us virtually. Home stretch of the session. Today marks day 35. Not that we're keeping up with that sort of thing. Not that we're keeping up with day 40. Sine die stands as March 28th. The FY24 amended budget's been signed into law, and the FY25 budget is now resting with the Senate. We have presented to the Senate Appropriations Committee already on those items. Grateful to all the appropriations chairs, appropriations committee members, and those budget staffs that and with OPB that reach out to us on a regular basis and help us all inform one another on the various options before us as a state. Also continue to be grateful to Brandy Sylvan and Caitlin Ward on the DCH team for helping us navigate through this process. Two of the best traffic cops in the business. And we're very grateful for the hours they're putting in this time of year. As far as the agenda today, as is often the case, represents a great deal of work on behalf of our team, but this month's agenda has an especially collaborative spirit to it. Several items today represent so much work between our team and our DBHUD partners, some of which have joined us today. And I know Brian Dowd will introduce them when he takes the rostrum shortly for the Brian Dowd show today here later once we get to the agenda. But we're very grateful to our sister agencies, our partners and OPB and our team as we all navigate this to a landing that is only intended to benefit these families and providers that benefit from these services, and grateful to the legislature and OPB for their leadership and prioritizing such needed investments to these systems out in the field. To be clear, these items are still pending before the legislature in the aforementioned budget process. But this action today is to get those items on the CMS for evaluation and hopeful approval. So we're not burning time, and we're showing these families and providers that we're ready to implement. But should the legislature and the governor's office need to pivot in any way, we have the ability to do that through the CMS process. So we'll always be responsive to what the ultimate desire of policymakers is as we wrap up session. Before we move to the agenda, though, I do want to point out that shifting to the redeterminations process that's still very much live and ongoing. We're very grateful to several community partners led by Senator Sonia Halpern. We have another redeterminations event coming up in Union City this Saturday from 9 to 2. We have information for that, several different sites, and can help provide anyone further detail on that. But we're very grateful for Senator helping us pull a lot of local leaders together. Very grateful to our DCH team, our DFACS caseworker partners who will be on site, really helping us through this effort and the outreach and messaging. Very grateful for everyone putting these events together. It's been quite a lift, quite a process. And then lastly, Mr. Chairman, if I may, I do want to recognize the employee milestones because there are a couple of big ones here. Starting with Lamarte Bell in financial management, 25 years with the state of Georgia. Very grateful. Mr. Fillmore in HFRD, 25 years. Tina Webb in MAP, 15 years. Virginia Barber, also in MAP, 10 years. Gary Rogers in HFRD, 10 years. Juana Clemens in MAP, 10 years. Ms. Cofield in OIG, 10 years. Mr. Higgins in drugs and narcotics, 5 years. Ms. Coleman in drugs and narcotics, 5 years. Jimmy Oho in financial management, 5 years. Liana Greenwood in the Georgia Board of Healthcare Workforce, 5 years. Brittany Smith, SHBP, 5 years. And then also, as we've been doing recently, I think we need to give a moment to recognize those who are hitting those 1-year milestones because we're grateful that they've joined our team. Natasha Canoe, IT. Ms. McBride, IT. Mr. Doan in OP, 1 year. Mr. Ellison in OP, 1 year. Katie Grogan in MAP, 1 year. Francis Smith, HFRD, 1 year. Mr. Burks, HFRD, 1 year. Maxine Belzer Gaston, HFRD, 1 year. Mr. Carroll, HFRD, 1 year. Ms. Corson, HFRD, 1 year. And Mr. Rabin in Georgia Drugs and Narcotic for a year. We're grateful you're on our team. We're grateful that you hit that year mark. Look forward to reading your name under those 10, 25-year marks one day. So grateful for your service. And last thing, Mr. Chairman, if I may, I wanted to formally introduce in person Stuart Portman, who was announced some time ago as Georgia's new Medicaid director. Through virtual visits and a lot of different changes to the agenda, has been participating in these meetings and agendas for a couple of the past few months, but is yet to be able to take the rostrum. So just wanted to allow him to introduce himself briefly this morning. Look forward to seeing you up there many, many more months in the years ahead. So thank you, Stuart.
Thank you, Commissioner Carlson, and thank you to the board. It's good to be with you. I'll just take a moment to introduce myself. I'm Stuart Portman. I am joining DCH from Washington, D.C., where I served as Senior Health Policy Advisor for all policies related to Medicaid and CHIP for the Senate Finance Committee in the U.S. Senate. So I had that role for the last 7 years, where it was my responsibility and honor to draft, develop, and write a lot of the legislation that touched Medicaid and CHIP since 2017. And so I have learned a lot. I have had the best and warmest of welcomes here in Georgia, and looking forward to diving into the operations and mechanics of Georgia Medicaid so that we can make sure MAP is successful and continues to be successful. So thank you.
Thank you, Stuart. And Stuart and his young family spent the beginning of this week in a moving truck, Mr. Chairman. So we're grateful that they've come down to Georgia and made this commitment to our state. So thank you, Stuart.
Yeah, thank you, Stuart. And you and I had a chance to get better acquainted this morning with a few comments. And I, besides welcome you to your new job, also welcome you to Atlanta from Washington, D.C. It's got to be a really positive move for you and your family.
He hears that a lot. That's great.
Okay. Next, we will move to Brian Dowd, who's got the heavy lifting this morning. He'll be presenting to us 6 different items. Brian is the Deputy Executive Director of Policy Compliance and Operations for Medical Assistance Plans. And these will be waiver programs that Brian's going to introduce to us for initial adoption, and appreciate you providing the written copies of all this for us in advance so we can review it. But I will turn it over to you.
Thank you, Mr. Chairman, Commissioner, and members of the board. I do know it was a lot we presented to you guys. So I have 6 items for the board to consider today. 5 of the 6 are 1915C home and community-based waiver amendments. And then the final presentation is a state plan amendment. Just as background for the board and everyone, this Medicaid state plan is what we provide in services, who is eligible for services, and how we as an agency provide those services. It's kind of how we do our business. It's available to all Medicaid members as long as they meet medical necessity to get the service. The 1915C waivers provide extra services to the state plan, and they are for specific populations, and they often can have service limits in those waivers. an individual who is in the waiver has to meet an institutional level of care. So that's a big differential between like what's in the state plan and home and community-based waivers. The extra services are there to keep that member out of an institution and in the community where it's cheaper. It's always cheaper to be in the home and community-based waivers than it is to be in the institutional setting. That's a foundational point of the waivers. Additionally, all of today's presentations involve recently completed rate studies. Rate studies are the process the state uses to determine reimbursement rates to providers to deliver services. When a state develops rate for services, they generally try and determine rates that are cost-effective and affordable while meeting the service delivery system's needs. In order to complete our rate studies, we engaged our provider community to obtain the actual cost of what it takes for them to deliver the services. Things like, what are they paying their staff? What is their brick and mortar cost? What is their fringe cost? But we didn't just stop there. We also looked at other states and private insurance and wage indexes and a bunch of other factors like rural versus urban modifiers. It's quite a lift to get a comprehensive and authentic rate. So we did that across every single thing we're touching today in one way or another involves a rate study. So the first item up for board consideration is an amendment to the Independent Care Waiver Program, or ICWP. This waiver is specific to individuals 21 years of age to 64 years of age with serious physical disabilities or traumatic brain injury. As a note, we don't kick you off once you turn 65, but you just got to be on the program before you turn 65. Individuals in this waiver must meet either a nursing facility or hospital level of care. Effective July 1st, 2024, pending approvals by the Center for Medicare and Medicaid Services and the Department of Community Health Board approval, we propose to enact the 2023 DCH rate study for ICWP providers. In 2023, DCH, in collaboration with ICWP Provider Network, underwent a comprehensive rate study program. The rate study met the requirements of Senate Bill 610 enacted during the 2022 session that required a rate study be completed every 4 years. DCH proposes to amend the ICWP waiver to adjust the rates as indicated by the rate study. The public notice reflects all the services within ICWP. Only specialized medical equipment and supplies did not indicate a need for a rate adjustment. Sometimes when you do rate studies, it doesn't always say that it goes up. Sometimes it says you're okay staying the same. Sometimes it may say that the rate even needs to be decreased. Sometimes people get in their head, oh, we're doing a rate study, the rates are going to go up. But it's not always that case. Sometimes we look at the rates and they're good right where they are. The fiscal impact of the proposed rate amendment beginning state fiscal year 25 is $9,734,732 with a total funds impact of $648,417. An opportunity for public comment will be held March 18th, 2024 at 1 p.m. via Zoom audio. Individuals wishing to comment in writing on the proposed changes can do so before April 15th, 2024. I'll pause now for any questions, but will respectfully request initial adoption of the proposed ICWP amendment.
Questions, comments from the board for Brian? Hearing none, is there a motion for approval for initial adoption?
Motion for approval, Cynthia Rucker.
Dr. Ruckers has moved for approval for initial adoption. Is there a second?
Dr. Coles, second.
Dr. Coles has seconded. All in favor say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Brian, thank you very much. You may move on.
Thanks, sir. The second item is just like the first item. It's just we've switched waivers from the independent care waiver to the elderly and disabled waiver program. This waiver is specific to individuals who are either elderly or disabled, and they must meet a nursing home facility level of care. So we did the same rate study. There were several services that it did not indicate a needed rate adjustment, such as enhanced case management, emergency response installation, and emergency response monitoring. All other rate adjustments were indicated and are included in the public notice. The fiscal impact for the proposed rate amendment beginning state fiscal year 25 is $29,841,786 in state funds, with a total fund impact of $87,821,618. An opportunity for public comment will be held March 20th, 2024 at 11:30 a.m. via Zoom audio. Individuals wishing to comment in writing on the proposed changes should do so on or before April 15th, 2024. I'll pause for any questions again, but would respectfully request initial adoption of the EDWP waiver amendment.
Any questions, comments for Brian? Hearing none, is there a motion to approve for initial adoption?
So moved, Hopkins.
Second, Folsom.
Move for adoption. Is there a second?
Second, Folsom.
Roger Folsom has seconded that. All in favor, say aye.
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 Opposed?
Aye. Aye.
Aye.
I'm sorry, I back up a minute. Were those approvals for approvals or for denying? Let's start over because maybe I rushed it too much. Sorry about that. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved, Brian. Thank you.
Thank
You may
you.
move on.
The next four items are in collaboration with, as the commissioner said, are in collaboration with the Department of Behavioral Health and Developmental Disabilities. I do want to thank Ashley Caseman and Wendy Tygreen for being here today. Just in case, first of all, they were instrumental in the board notice construction and in the work we did to get to this point. But also they're a lifeline in case I mess something up that I can yell out to the crowd and be like, hey, Ashley, Wendy, help. But we have four items that we're going to introduce. The first one is an amendment to the new options waiver program. Just like we did with the previous two notices, we did a rate study for this waiver. The waiver is specific to individuals who have an intellectual or developmental disability, and they must meet an intermediate care facility for intellectual disability level of care in order to be in the waiver program. The rate study for this waiver actually started in 2022 and carried on to 2023, so a little bit differential there. Also, in this waiver, we are increasing caps on services as indicated in the public notice. So you will see for this waiver that there are some increases in the caps per service that correspond with the rate increase. We also are introducing wage caps on individuals in the self-directed program that are going to be included effective April 1st, 2025. Individuals may still negotiate their rate if they are self-directed, but the wage cap will be up to the corresponding agency rate less the cost of taxes. Fiscal impact of the proposed rate amendment beginning state fiscal year 25 is $3,818,963 in state funds, with a total funds impact of $11,316,283. It's important to note for these next four board notices, the state funds for these services appear in the DBHDD budget. So they do go directly to the DBHDD budget. An opportunity for public comment will be held March 20th, 2024 at 1 p.m. via Zoom audio. Individuals wishing to comment in writing on the proposed changes can do so on or before April 15th. I'll pause for any questions and would respectfully request initial adoption of the now waiver program amendment.
Any questions, comments from Brian? Hearing none, is there a motion for initial adoption approval for the NOW program?
Motion for approval for initial adoption, Cynthia Rucker.
Dr. Rucker has made the motion for adoption. Is there a second?
Shane Mobley seconds.
Shane Mobley has seconded that motion. All in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved. Brian, thank you very much, and you may move ahead.
Thank you, sir. The fourth item up for board consideration is an amendment to the Comprehensive Supports Waiver Program, or COMP. This waiver has the same target population as now and went through the same rate study process as now. So that included the 2022 and 2023. The public notice lists all the services that the rate study indicated a needed increase. If there were services that did not indicate a needed increase, then they were not listed on the public notice for the board. The comp waiver is also increasing caps on services as indicated in the public notice. And the same wage caps on wages paid to self-directed individuals providing community living services, community access individual, and respite are included in the waiver amendment, again effective April 1st, 2025. Those individuals may again negotiate a wage for their staff up to the corresponding agency rate, less the cost of payroll taxes. Additionally, we are including the self-directed model for supported employment services as part of this waiver amendment. We're putting that back into the waiver. The fiscal impact of the proposed rate amendment beginning state fiscal year 25 is $112,658,930 in state funds. I'm not used to big numbers like this. With a total funds impact of $333,828,966 million. It is important to note that the state funds for the comp waiver services, again, are allocated to the Department of Behavioral Health and Developmental Disability budget. An opportunity for public comment will be held March 27th, 2024 at 11 a.m. via Zoom audio. Individuals wishing to comment in writing on the proposed changes should do so on or before April 15th, 2024. I will pause for any questions, but we respectfully request initial adoption of the comp amendment.
Are there any questions or comments from Brian or Brian? Hearing none, is there a motion for approval for initial adoption?
Shane Mobley motions.
Shane Mobley has moved for approval initial adoption. Is there a second?
Second, Hopkins.
Dr. Lee seconds.
The motion has been made for approval and seconded. All in favor, say aye.
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 Opposed? Abstaining? It is approved, Brian.
Thank you, sir. The fifth item up for board consideration is an additional component of the amendment to the Comprehensive Supports Waiver Program. Effective July 1st, 2024, pending Centers for Medicare and Medicaid Services approval and the DCH board approval, we're proposing to add 3 new community residential alternative services models to the COMP service array. Those 3 new services are specialized transitional community residential alternative, or CRA, behavior focused CRA, and intensive CRA. These models are designed specifically to serve individuals with complex care needs who are currently unable to be supported by traditional CRA models. They're folks that may be in a crisis home or in an out-of-state placement. This will bring them home to Georgia or out of that crisis model. They share very similar characteristics, but behavioral focused CRA is intended to be short-term placements for individuals with challenging behaviors until they respond to treatment and can be transitioned to another setting. Specialized transitional CRAs are intended to provide short-term placements for individuals being discharged from other settings like those crisis homes, but they also have demonstrated significant aggression, self-abuse, or dangerous destructive behavior. Intensive CRA are expected to be long-term placement, but they are placements where they can't be supported in another arena. Providers will have to be enrolled currently as a CRA. The homes will not have more than 4 placement. Direct support staff must hold a registered behavioral technician certification or someone who has training in supporting individuals with complex cares. And the providers must have 24-hour access to registered nurses and board-certified behavioral analyst supports. The payment rates for these services were designed consistent with the provider rate study that we conducted in 2022 and 2023. They'll be reimbursed on a fixed monthly rate of $37,121.50 for specialized transitional CRAs and $34,424.63 for behavioral focused CRAs. The rates reflect high staffing patterns and what is expected to be significant turnover. If an individual is in the home for less than 15 days in a calendar month, the provider can bill 1/2 of a unit. The payment rate for intensive CRA, which is variable, is determined on an individual case-by-case basis. Providers will submit a staffing plan to DBHDD for approval. What type of staff is going to be there, registered nurse, technician, and the number of hours expected to be delivered by each support staff. The fiscal impact of the proposed rate amendment beginning state fiscal year 25 is $7,892,915 in state funds, with a total fund impact of $23,388,147. An opportunity for public comment will be held March 27th, 2024 at 12 p.m. noon via Zoom audio. Individuals wishing to comment in writing on the proposed changes should do so on or before April 15th, 2024. I will pause for any questions, but would respectfully request initial adoption of the Comprehensive Supports Waiver Program amendment for new services.
Any questions, comments from the board, please? Hearing none, is there a motion for approval for initial adoption?
Motion Williamson.
Motion has been made for initial adoption approval. Is there a second?
Second, David Cruz.
Motion has been seconded. All in favor say aye.
Aye.
Opposed? Abstaining? Hearing none. Brian, you may move on to your last item.
Thank you. The sixth and final item for the board consideration is a state plan amendment to Community Behavioral Health Rehabilitation Services, or CBHRS. CBHRS comprises the majority of community mental health and substance use disorder treatment within the Medicaid program. Effective July 1st, 2024, just like the other waivers, the state plan service, we completed a rate study. And that rate study was done in 2022 and 2023. And we proposed to amend the state plan based on that rate study. Additionally, the state plan in the CBHRS section will be amended to update accreditation language for the Administrative Services Organization and add community health workers to the list of accepted practitioners who can provide rehabilitation and skills training services under the qualified agency structure. The fiscal impact of the proposed state plan amendment beginning state year 25 is $54,773,792 in state funds, with a total funds impact of $161,289,141. Again, these funds are in the DBHDD budget, the state funds. An opportunity for public comment will be held March 20th, 2024 at 10:30 a.m. via Zoom audio. Individuals wishing to comment in writing on the proposed changes should do so on or before March 27th, 2024. The public comment period for state plans is shorter than the public comment period for the home and community-based waivers. So I just want to point that out. You have to have your public comments in before March 27th.
And that, but that is an important distinction because all the programs you just introduced all had public comments for March 27th. And for the public and stakeholders in this will be March 20th for the public comment.
April 15th was the waiver ones.
April 15th.
Yeah, because they have to be open for.
Written by April.
Written by April
15th,
15th, right.
But your virtual public comment was March 27th.
Exactly, exactly.
Whereas this will be March 20th for
Correct,
virtual public and then March 27th for the written. So
correct.
there's a different, we went through 5 that had set dates and this one's different, just for everyone at home.
Good point. Yeah, the actual hearing date moves up as well because the timeline for public comment on a state plan is compressed. Very good point. Thank you, Commissioner. That's it for this public comment. I'll pause for any questions, but would respectfully request initial adoption of the proposed Community Behavioral Health Rehabilitation Services State Plan Amendment.
Any questions, comments for Brian, please? Hearing none, is there a motion for approval for initial adoption?
Folsom motion for approval, Mr. Chairman.
Folsom has made the motion for approval. Is there a second?
Hopkins, second.
The motion has been seconded. All in favor, say aye.
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 Opposed? Abstaining? It is approved, Brian. Thank you very much for your presentation. And you, as you said, you talked about a lot of big numbers today. I'm not relate to some of those big numbers, but I think the important thing is here, it really shows the commitment that the state has and the legislature has, and in the part of the budget to provide more funding to help people in Georgia get better health services. And that's very much in line with our mission statement. And we thank you for doing all the work and putting this together. I think
Absolutely.
it'll be very interesting to see the public comments that come back, and when you come back for final approval, if you've made any adjustments or need to make adjustments. So thank you very much, Brian.
Thank you, sir.
With that, is there any other business that anyone knows that needs to come before the board at this time? I'd like to recognize our IT staff today because for the first time, we were able to do a meeting without interruption. And so very much, I know that they did a lot of practicing with large groups to make sure when we have almost 100 people online, sometimes the system gets overloaded or whatever happens. But we made it all through today, and thank all of you. We had a full board quorum today, all 9 members participating, and appreciate your time. And have a good day. Meeting is adjourned.
Thank you, Mr. Chairman.
Thank you.
All right.